PM. Okay, has everyone had an opportunity to review the minutes from last meeting? I would entertain a motion to approve those. Okay.
A second.
Okay, all in favor?
Aye.
All right, we approve our minutes from the last meeting. Division reports. Is anybody speaking regarding division reports? Did read over those. I did have a question on the vital records because 2024 to date compared to 2023, so that was for the entire year of 2023, and we are year to date for 24. Okay. Question there. And since I attended the meeting that our state health director, is there any discussion on that or any additional information regarding that
We can
meeting?
talk about it.
Okay, perfect. Okay. All right. Any questions or comments regarding division reports?
I know it's been some time, but seeing your presence at the 4-H fair and engaging with the community, and just I think the outward involvement of the health department in the community has been very, very positive to see. So I just want to thank you for that. I'm not sure that it's always been that way in the past, or maybe it's not
Many years
been
ago.
shared, but
Yeah.
yes, I mean, that was definitely a good thing to see.
You said you're going to speak to the vital statistics.
To that, I will speak to that, but about Dr. Weaver's visit, I'll be speaking about.
Is it unusual for us to have as many cases of foodborne disease as I see showing up in the infectious disease prevention and control? We've got Campylobacter, Cryptosporidium, Salmonella, and C. hep I, but hep B and hep C.
No, I don't believe these are abnormally high numbers.
Okay, all right. They don't just always show up in our monthly division reports, so.
We're working on
Good, I like that. Yeah, no, I like that very much. Were we able to identify a source on any of these?
No.
Do these come from the hospital or your testing?
They come through the state database.
So if we send it to state lab, then it comes back, okay. I was gonna say, this is very in line with what we have been treating, so.
You're sending it, really? Okay. That's pretty rare around here, isn't it? Okay, all right. Thank you for adding that information, because it really is important for us to see both cases, but also trends, so. Okay, all right, can I entertain a motion for approval of our division reports?
So moved.
I'll second.
Okay, all in favor?
Aye.
Reports are approved. Dr. Woods, it's your turn.
Thank you. I wanted to update a little bit about our visit with Dr. Weaver. She came, I believe it was Friday, September the 6th. and met with the entire department, and a few board members were able to come. It was meant to be a roundtable discussion. She wanted to hear what we were doing primarily with our HFI monies and how we were utilizing that in the community. So our school health liaison was able to share all the initiatives that are happening with all the different schools. We were able to share about our community education event with diabetes self-care through the Purdue Extension programs, which are now in full swing and are being offered in multiple locations. And also about how we're providing continuing education opportunities for physicians and nurse practitioners regarding the management of diabetes and obesity. And also we're providing educational opportunities for mental health clinicians in the realm of maternal mental health. So we're seeing our money well spent. She was very affirming of what we were doing and excited, and we asked some questions about what's this funding going to look like after 2025. She said when they went to the legislature and got the Health First Indiana monies approved, they told the legislature this is a 10-year initiative. You know, we're not going to see changes in our numbers in a 2-year period of time. And so the legislature was made aware that we're looking at 10 years, but they have to re-up and get this budget approved every 2. So they will be revisiting this at the end of 2025. And part of her 92 county tour was to hear the stories of what's happening in each county with these monies and how it's making a difference in the health of our citizens. So were there more questions about Dr. Weaver's visit? It was fun to have her here.
It was.
Yeah.
She brought several of her staff members with her, and they shared some interesting things as well.
Yeah.
So it was really good. I was glad I came. It was kind of a last minute decision to pop in and see, but yeah, I think there's, at least my opinion, appropriate awareness of the magnitude of the problem at the state level. And I do feel like they're really working to help us.
Yeah, in 2024, there were only 5 counties that opted out.
Mm-hmm.
In 2025, all 92 counties have opted in.
I wonder.
So everybody's seen the benefit. It has come with a few extra responsibilities, which we've been able to meet because of that money. So we're really grateful that that's available to us at this point. And then regarding the vital records report, you'll see the deaths total. As of September, the things that we've been looking at specifically, we're up to 10 deaths by overdose for the year, but look at that compared to the total of 23, we're well behind where we were at this point in 2023. So that's really good news. I can't count that to anything we're doing except just a lot of conversations are happening in our community about the problem. And we're at 5 deaths by suicide, and we had 24 in 2023. So we're well under what we experienced in 2023. So that gives me hope for what's happening in the mental health community with our many agencies working at this towards these issues. So I'm grateful for the trends we're seeing as of September of 2024. Another issue that just came up, and I think it's important for the board to be aware of, is we got new data from the state regarding our childhood vaccine rate.
Mm-hmm.
And what they track as a key performance indicator is the children up to date on vaccines at 35 months. So before they turn 3. We had been smack dab in the middle, right at the 50th percentile. We've plummeted. We only have 7 counties below us in that number. And so we don't know why. This is not just health departments, it's everybody in Grant County offering vaccines to that population. When I learned this data, actually today, we got all this today. I went on a road trip across the county talking to vaccine providers of children to see if they had any insight. And I talked to the pharmacy, Walgreens. They do not offer vaccines to this population. They don't offer the vaccine. They don't offer to Medicaid, children on Medicaid. So the pharmacies are not a resource to vaccinate our children on Medicaid. Our Marion Health practice is fully engaged with Vaccines for Children, so they're fully offering vaccines. Indiana Health Center is offering vaccines to Medicaid children along with Marion Pediatrics, which is privately owned. Marion Family Practice is offering the primary series of childhood vaccines to children on Medicaid, except for flu and COVID. That's not being offered to patients through Marion Health, and the health department is. So it doesn't seem like access is likely a problem. And things have gotten worse since the pandemic. I mean, after the pandemic, children born in 23 and 24 are behind. So it's not that they were stalled during COVID. It's happening even after. So one theory would be that all of the anti-vaccine dialogue and controversy with COVID has made parents afraid for the usual childhood vaccine series. There's no other reason that we can find to explain why parents are really lagging. So it's just FYI, we're just trying to explore and figure out why this is happening and make sure from our end that access is wide, especially for children on Medicaid, because a lot of places aren't available to them, like pharmacies. So I believe that's all for me unless there are other questions.
I do have a question too, because I talk about vaccines a lot, just because of what I do. And I'm hearing a lot of negative opinions about vaccines in general from adults as well. Like people saying, I'm not getting a flu vaccine anymore because, I just don't trust, blah, blah, blah. And I think it's just really an unfortunate situation that I'm not sure that there's an easy answer for overcoming that negative bias.
And maybe Dr. Bragg can speak to this too, but it seems like after all the COVID vaccine drama, it made people question across the board vaccines. So we lost a lot of ground.
Wouldn't that have been the case throughout the state? Because we're measured, if I heard you correctly, we're in the middle and now we've dropped.
Right.
If that were the problem, it seems like it would have been a statewide problem unless.
Right, yeah. Yeah, and the data we were working on, the most recent data we had was 19 to 21, and that's what they based all of the numbers on. And so now they're actually keeping a very live system, and we'll get updates every 3 months. So we'll have current data to keep working on versus from 21.
There's been no change in the schools, you said it less than 3, so never mind. We're talking about a different group.
Yeah, then we see people catch up as mandated by the school system, but that's late. We're missing the, early.
I think we're still suffering as well from some harmful data that was not accurate, that was produced about autism. And so as we've had an increase in autism diagnoses and parents fearing vaccines for that reason. And so I think we just need to continue to get education out there as well about autism not being caused by vaccines, but I think we still are combating that as well, that misinformation that was published, unfortunately.
So we're just looking into it. It's all new data, really hot off the press today. So trying to figure out how we can improve on this.
Okay, very good, thank you. Okay, appears that we have no old business, so we will move on to new business and the polling site waiver request. Has everyone had an opportunity to read to read all of the information regarding this, but I think if not, we need to take time to do that. So we have communication from both Alice Quinn and Tom Adams. And then a letter from Hollings, which that is not included in our packet, correct?
The email, no, I think I did email each one.
Do you want me to go print it?
Okay.
I can go print it for everybody.
Yeah. Because unless you guys want to give your side of the story just verbally as opposed to printing that, that's,
Yeah, I mean, I can
That's
just kind of
fine.
give us a quick synopsis of
Okay.
the kind of scenario. So, had a home there, it burnt down, several years go by with us fighting and arguing with the insurance company. They finally settle, lo and behold, most of the money gets taken by the lawyers. So we don't have enough money to build. So it takes a while to save up the money to be able to build again. We go to build, we have a soils test done, and when Chuck dug the pond, he took the dirt out of the pond and basically spread it all over the
Sure.
yard. So they're saying that because that's not natural lying soil, that you can't put a septic system there. The soil scientist doesn't seem to think it'll work. The State Department's whole contention is, well, the house has been gone for so long now that it's new construction. But it's not. It's you know, it was an existing home. It had a very nice house on it to begin with. In our professional opinion, we believe the system will work. We would not waste our time, energy, money, all this effort to have a system fail. The other option for the State Department was to go on a pump and haul. So today, just loosely figuring, with just two of us living there, and since we own a business where we could pump and haul it ourselves, but
Sure.
we still have to pay the city to dump it there, we're looking at about $600 a month. If in 5 years we decide to close the business and we no longer have a truck to pump it, we would have to pay an outside source of at least $1,500 a month to do that. The other option is to connect to sanitary sewer, which is 1.5 miles away approximately. Very not feasible. And our contention kind of was too that we know there's a lot of aging homes, a lot of subdivisions. We're going to run into this a lot coming up in the next 10 to 20 years. Why not let us try something on our own property? We're willing to, if it does not work, cap it off, pump and haul it until we can either acquire another piece of land somewhere or run it to city sewer. We've talked to the neighbor to the west of us, which is the only person that we could possibly buy land from and put a system on. They're not willing to sell. We've tried it, we've pretty much exhausted all avenues to try and to get to an end result. I know Jeff, we've talked about it a lot. I understand his position. I used to do his job. I get where he's coming from. It's scary to make that call, if it fails, it's going to come back on me. We're more than willing to sign a release of any harm for anybody involved. And if it fails, it'll be on us and we'll rectify it, one way or another.
Well, I came to before this board 2 or 3 years ago. Basically the same scenario. Alice said it wouldn't work. It's been working for 3 or 4 years now.
we've not had any
I've
problem.
been doing this for 39 years. I wouldn't waste my time. I didn't think it'd work. And there's good soil down there. I just got to dig a hole 4 feet deep, fill it up with sand, because that's your filter. And if the water don't flow through my property is at least 4 foot higher than one neighbor, probably 12 foot higher than the other. So my property is like this. I have grass everywhere. If it was nothing but a floodplain like they're saying, I wouldn't have grass. I mean, grass don't grow when it's flooded with water.
So the existing, I'm assuming there was an existing system
Yes, it was-
on that
it's a-
property
yes, it's a
before the
sand
home
mound.
burned.
It's what they call a sand mound, but it's different than what we have today.
Yeah, it's an older system. Larry Bright is actually the one that installed the system, and it's there.
Yeah, it's got 2 tanks, and it goes into a hole, and they put sand in it.
It's so
Now,
deep though, I can't dig it up and show them, and it's not a system that they would approve by today's standards, basically.
And, we're gonna run into this all over the county. And what everybody's gotta understand is each county runs their own environmental. Okay, because even Alice, when she was our environmental person, I put in 2 fingers 75 foot long for a house, because that's all they could do. I mean, you have to give the best judgment. I had a $200,000 house there, which today would probably be 800,000. And now they're telling me I can't build one. It's all because of a septic system that I'm willing to sign a paper, take full responsibility. And this is the thing that everybody forgets. If a system don't work, the county don't get sued, Jeff don't get sued. We do, the contractors. This is on the contractors, not on the county. That's why I don't never understand why everybody's so hard to make these best judgment calls. Because most of us contractors, we're gonna try to do what's best to make sure it's gonna work.
So I have a question. So you have like a license and a bonding system.
Yes.
Does that cover work you do for yourself?
Yeah, I have insurance too.
Yeah.
Okay.
As long as we use our company trucks and our company men, yeah. So all,
So
Yeah.
your own personal or your own business policy will cover work that you
Yeah,
do for
I get billed just like everybody else does.
and the materials for this septic system alone are 15,000 plus. I would never waste that kind of money if I was concerned that it was gonna fail,
Right.
pollute the environment or any of that.
And my neighbor has a pond, and I also have a pond. So,
How does
So
that
is the
influence the
concern that it
situation?
will not flow because of the type of soil that's there, that it's not gonna run off, or that it's gonna run off
it's not
too
gonna run
much?
through.
What they're
Because
saying
you
is
just
once-
told me your neighbors are lower than
Yeah.
you.
They're saying
You've
that
got a
once.
pond, so where is this going? I guess that's my concern, like if I'm your neighbor, where's
Yeah,
it going?
The neighbor to the east of us, his pond is on our east property line. We're putting the new septic system on the west property line, and our pond is on the south property line. So, I mean, and everything will be a proper separation as far as away from ditches, ponds, any of that. What the soil scientist is worried about, when he dug down, we have all this filter. When we get down to natural soil, it's compacted a little bit, because when he put all that soil out there, of course, you run over it and run over it and run over it. And what he's saying is once that water gets through that sand, which is going to filter and clean it, so the water's going to be clean when it hits that soil, he's saying the water's not going to move, that it's going to fill up like a bathtub there. And if that was the case, then that whole property, no trees would grow, no grass would grow, because if water doesn't move through the property, nothing can grow
I think
properly.
the rainwater would just pool, according to what they're saying. It would be like a bathtub.
Is that the only soil test you had done over a year ago?
Yeah, because I've been asking,
You haven't had it tested since?
No, because once you do a soils test, it's, unless you add dirt or take away dirt, it's pretty much the same testing. But I've talked with Mike Metler from the state. I've talked with Jeff numerous times about it. I think David and I have talked about it several times. For the last year, for a year, and I can't get anybody. Mike Metler's like, well, hey, I think this property qualifies for discharging. Well, when I asked Jeff about that, There's a whole process through IDEM, it has to be a sewer district. Well, that's not gonna suffice for one home. I mean, that's not gonna be feasible. And that would be feasible for like a subdivision where you're having an issue, but not for just one single residence. Like I said, I've tried to exhaust everything. I've asked neighbors about buying property. I've thought of every which way, and even the pumping and hauling, $600 a month on the cheap end. That's us doing the pumping and just having to pay to dump it at the city.
And that's my cost. I mean, that's just what I pay the city fees.
Yeah, that's not like hiring, having the guys go do it, the gas of the truck, the insurance, all of that, so. But I think what we're just asking for today is special exception, basically, like, let us try it and,
Which we've done in the past.
Right, that was for
We have done that in the
the, for the Manning's property. Mhm. And they said the same thing about that, when it wasn't gonna work, they wanted us to put a $75,000 system in.
For one house.
And that's just so exorbitant, and they're like, well, we can't worry about what it costs. Well, you can't just, expect people to pull $75,000 out of nowhere, I mean.
And we ended up doing it for $40,000. You know what I'm saying? And it works.
And I've been by there several times, and that system is still functioning, and there's no issues.
Okay.
We have Jeff up there, he's.
Okay, you had questions or? Jeff, did you have input you wanted to, can you hear?
Yes, I'm here. Good evening, everybody.
Hi, Jeff.
Okay, so the soil report, it's not actually a soil report. It's a letter that says that the site is not suitable. So I wouldn't have any way to work up the minimum requirements for the sizing of that system due to that, because that's what we work off of, that, the soil report and the application, and that's how we size a system. This letter says that there's one pit that had fill material, and let's see, I'm reading through it here. Had no original soil. It was all fill material. And then the second pit had fill material over 17 inches of original soil that was compacted heavily on top of dense compact glacial till. So that's where we're getting that we don't think it's going to work. I don't know. I don't have a way to work up minimums for the sizing and such. And
What I was gonna propose to do basically was use the minimum, the lowest soil loading rate, which is a 0.25 loading rate. That's the lowest we do for elevated sand mounds, basically. When you don't have enough soil to put it in ground, we build it right on top of the ground. And we actually was gonna propose, I think we were only planned on building a 3-bedroom house. I actually was gonna propose a 4-bedroom system just to give us some extra room. And these particular type of systems, they're not like a traditional, some of the systems when they do a dosing, it's the full dose for the full day, which is like 600 gallons. Most people don't use 600 gallons in a day, but it throws all of that out there and then it gives it a period of rest. These Sandline systems only do 1/6 of the daily design dose. So if we had a 4-bedroom design, we would actually only dose 100 gallons at a time, which would also give us extra time to let that water get through the sand and move through the property.
And you're basically looking at what's the sand's like. I use 2 to 3 foot on a normal system. We're digging 4 foot of sand first. So you're putting 4 foot of sand.
4 or 5, yeah.
Then you're putting your system on top of that.
So is that like a sand mound system is what you're talking about doing?
Yes.
Which is an alternative system to the regular,
Right,
Yes.
right.
which is more expensive.
Yes. It's more expensive, but they work better.
Right,
So-
exactly.
There was a comment, I think, Chuck made about if there is a waiver that the people that are at risk are the contractors. Is that a factual statement in a situation where we're looking at a waiver? Is that the right term, waiver?
So there's two, you're talking about two different issues. I think you're mixing them.
Okay.
The first issue is the waiver, which they as homeowners would sign saying that they would not hold the county liable if there was any, by us granting them a permit, if there's any issues down the road. They're waiving any liability we might have. That's issue number one. Then what Mr. Pulling is talking about is when these issues come up, the county's not really at risk. It's between the homeowner and the contractor. It's not really a county issue per se. There are situations where it could be a county issue, but in this particular case, they're waiving that. That's what they're asking for. This is all about giving them a waiver to try this, see if it works. And from my perspective legally, they have a system which I mean, I'm not an expert either, believe me. I know Mr. Pulling is, I know Brandy is, and I doubt very seriously they'd risk this kind of money to do this if they didn't think it would work. I am a mechanical engineer. I do have some understanding of system. Well, not again, I have a degree of practice, but I understand, the system, how it works. I personally think it'll work myself. And I, legally, I see no harm in granting them a waiver to do this. So I think the health department brings it to you to have you make that call, not them, like Jeff. That's why it's in front of you, that call whether to grant them that waiver or not. And in this particular case, the other concern I would have is we did grant it before. And if we don't grant it now, they could theoretically argue that we're, being random in how we do things, which we're not supposed to do. And secondly, if there ever was a problem, he actually has the capability to fix it by pumping and hauling himself, which the other people didn't have.
Plus, if this does work, guys, this is going to be another option on the table to help.
For other people.
But for clarity, holding tanks were not an option when we did the manning site. They were not an option.
What was it?
The holding tanks, the pumping and hauling.
Yeah, but it's still
not
an
option
absorbent
provided
amount of
by the
money.
state.
It's still a large amount of money to
Right.
ask somebody to pay. I mean, it's not, not a small amount by any means. And I know the Mannings actually had only gonna be two of us. They had at least 5 to 7 people in their home, so they would have had to have pumped and hauled.
How long ago was that? How long ago was that waiver granted?
I'm so sorry, I can't hear you.
How long ago was that waiver granted? And if it's
4 or 5
not,
years ago, maybe?
I think it was 2019, because I think Jeff was pretty new at that
5 years
time.
ago, yeah.
Yeah.
and the state regulations have changed since that time.
Mhm.
So it was under different regulations.
Yeah, but even the state was here, and she was in the board, okayed it, even after she said no, and it worked. I mean, it still worked.
So,
What's,
I was gonna say, so, in theory, if we grant this waiver, then does that eliminate Jeff's requirement to specify your system capacity?
What Jeff is saying is because there's not a SOAS report, he doesn't really know how to size it.
How to size it,
Yeah,
right?
because there's not a
So,
SOAS report. So what I'm saying is we're gonna do it,
Largest system.
yeah, we're gonna do it for the most restrictive, basically. We're gonna use the most restrictive, make it the largest system with the most, extra, so that
Sure.
we ensure that it does function.
but have you created that proposal to the health department to date?
I have not turned the actual plans in. Jeff and I have talked about it. I've expressed what I would like to do. I also expressed that to Mike Metler, which is actually the head of the environmental division. I got the plans, I just haven't turned them in yet because I wanted to, it's a lot of work to turn in if you're not gonna,
Jeff didn't want to make that call, so we didn't want to turn the plan, and we already made the plan, we got it flagged and everything, we done everything we do on everybody else's house.
flag the system out, did all the elevations, did all the paperwork.
I think, Jeff, did you have a comment?
Yes, just for clarity, on a new construction, you have to meet every consideration of the rule. And I've consulted with the state on this, and they did have, you've got it in front of you. They did have them concerns And if we do this, I'm going to need guidance on sizing from the board. And who's going to be liable, who's not. Because I got a bad feeling on this. The Manning site, if I remember correctly, there was 4 feet of fill material, and I think they had better soils underneath that.
They did not, they had 4 filter.
And Jeff,
I
if
don't
you
recall.
remember,
I haven't read that in a long time. So,
Jeff, if you
but I thought
go back and look at the minutes, if you go back and look in the minutes, we run our own health departments, every county. The state is advisory. We have to make our own calls in every county. That's the law. If you go back and look, even Alice will tell you that, when we had to go against her.
So I have a question. If I'm a neighbor to this property and I have sewage runoff on my property from their system, what happens then?
The neighbor could theoretically have a complaint against them and have a legal civil cause of action.
And if they turn us into health
At
department,
their own expense?
Yes, it's between the 2 property owners.
Right.
Yeah, they would complain to the health department.
They make us cap it.
The health department would be more of a, potentially be a witness more than anything on what's going on. Contractors might testify, the health department might be considered an expert and testify.
And I've actually been in business before we had environmental. So we actually helped the environmental when they started it.
To try and make it better so that we were doing less pollution. Because a lot of people were connected straight to a creek, straight to a pond. They were polluting the waterways. And I know up north, the lakes have started connecting the city sewer up there. And the lakes are so much more beautiful now. I mean, they really have cleaned it up there, getting the sanitary sewer to them.
I'm not saying you guys would, but just hypothetically, if you ended up moving or selling the house and the system failed, what would happen then? Just
When you
leave,
put a mound in, system, and that's the good thing about a mound system versus gravity. Because gravity is 5 meters, if this goes bad, you have to move it over here, okay, in a different spot. When a mound goes bad, you just dig it out, put new sand in, new pipe, and go again.
With the sand, with the sand system.
Right.
So to answer your question, what generally would happen is the new homeowner would have an inspection done. If the system's good, then there's no problem. If it's not, then it's gonna have to be remediated at the seller's cost.
Yeah.
okay, so that would come back on the health department.
This is not a waiver. The waiver says the health department is not liable. They're agreeing ahead of time to take the health department out of the equation.
And who's preparing the waiver?
I think we have a sample form we use.
No.
All right, so there's already form work in place
We've
that,
done a waiver before. This isn't the first waiver we've ever done.
We did one for the Mannings. I don't have the sample, do you?
I probably have it in my file. I'll have to go back and look.
I will prepare it if that's the question.
okay, all right, yeah,
I will prepare it, yes.
So when I was looking at this, my concern was whatever precedent or what we were setting up. And what, if I'm hearing you correctly, what you're saying is since it's been done, there's been a waiver, we're actually going to be at risk if we didn't grant the waiver.
So the system, the way it's set up with the waiver is on the more complicated cases that come to you as a board on a case-by-case review. All these cases are fact sensitive. You have to determine from the facts if you think it might be okay or not. For example, if this was a half-acre property out on Home Corner, you would be very skeptical of doing this because there's a good chance, it's only half acre, there's no more land to do anything else, it would run onto someone else's property. If you're talking out in the middle of nowhere on a 2-acre site, when you got a pond on one side and you've got, I think, woods on the other side, a road on one side, and a pond on the other side.
Yeah, there's a strip of woods in
So-
between where we're gonna, and then we have.
So
part of
these
it.
facts would tend to maybe say, well, try and see, because if it works, it's actually giving you a solution for this comes up again. If the waiver process is case by case, what I think they're saying indirectly is that it's been granted once before, it would kind of be arbitrary and capricious of us, which is what we're supposed to avoid as a governmental unit, to, well, we're going to give it to them under potentially worse conditions, but we're going to stop them from doing it. That makes sense. I hope that answers your question. Sure.
I think the struggle though is we just revised this plan this summer, right? I mean, we just approved the
Well,
new,
the state just approved the new
Right.
ordinance that had been approved. Yeah.
and so in
And
a
the
very
rules-
short time, we're in a sense negating what we've put into place ourselves.
The rules and the ordinances really aren't that much. I mean, what little bit has changed in has not been like astronomical changes. I mean, there've been very minute and small changes. What Jeff is saying is that because they're considering this new construction, because the house is gone, and because the house has been gone for so long. Had this happened, a year after the house burned down, they'd have given us a permit and let us do a best judgment call because the house had just burnt down. But now, because it's been so long, that's what they're saying. Oh, it's been too long, now it's new construction. It is new construction, but there was a house there, and it's just like any other property. If there's a home there, we have to do everything we possibly can to keep a home there, you know what I mean? Because if not, there would be so many places out there, like Chuck said, he's put 2 fingers 75 foot long. Larry Bright and I were just talking about this, and Alice Quinn let them do this when she worked here. They filled in a hole, and then a year later put an elevated sand mound. Well, that's fill material. You're telling me I can't put a system in fill material, but I know you've done it. I've seen it done. I've had to make judgment calls. And it is nerve wracking. There's still properties that I drive by and go, oh, thank goodness that's still working. I mean, because you do worry about it, as an environmentalist, you worry about it. Even when you quit working for the health department, you don't know when somebody's going to call you back in for a property that you deemed uninhabitable 15 years ago, and they want information on it.
Well, technically, when the house burned, I had to fight the insurance company for 7 years. You know what I'm saying?
When did the house burn?
2009.
Oh, long time.
Technically, I could have tied right back to the same system I had if I wouldn't have to fight with them.
And there is an existing system there, but it's not something that the health department would be able to approve as of today's standards.
But it worked back then.
Yeah.
Yeah, it's got 2 septic tanks. It went into field and everything. Just because it's a new house, you can't use everything for the new system.
Well, and those types of systems that they allowed in 75 or whatever that was originally put in are not the same type of system that they allow now.
Because I had a 5-bedroom, 4-bath house there, 5,600 square feet.
So from the health department standpoint, if we put a waiver and an exemption is put into place for this system to go in, if say in 5 years they sell the home and an inspection is done, would that system carry forward, or would we have to have a longstanding exemption for this designated property? What is our ongoing obligation beyond whatever the board commits to today?
I think you answered that.
Are you asking me or Jeff or them?
Jeff or
It's a
health
legal
department?
question, so you really should be asking. I have no clue. He's not an attorney. He doesn't know how it works.
But I mean, like, if somebody buys
No,
the
it's an
property,
excellent question, and that's what we just kind of talked about. At that time, the homeowner should, not all the buyer should, not all buyers do, but they should have that septic inspected to see if it's operational.
and if it's operational, but it's not under the standard that we've approved, is that going to create a problem in the future?
No.
Or will that,
Not
Carry
unless
forward.
it fails.
Right, just like the man.
If it fails at some point. Was the Manning waiver attached to the property?
I don't believe so. I don't remember if that was recorded on
I
the
think
property
it was.
deed. Maybe it was.
I think it was a requirement that it
Which-
be attached to the property.
I mean, it's not, it's not, they can if they want. I mean,
Yeah, but once you put the system in, if it's gonna fail, it's gonna fail. It ain't gonna work for
years on end, and then all of a
It's gonna
sudden.
fail. It's not gonna work.
So to answer your question, I would say no. Because what I would say is, if this waiver will be on file, it's public record, they could do, the potential buyer could look and see, well, this is in there, and then they could factor that into their decision on whether they wanted to buy the home or not. They have that information up front, or they can obtain it.
We don't plan on selling the property. It'll be given to one of the kids. Now, what they do with it after we're dead is another story, but I mean, as far as what our near future plans are, that'll be our home until he passes and then I pass and then the kids, one of the kids will end up with it, so.
And I did take pictures of the property if you want to see it.
Yeah.
There's grass everywhere. So, grass
I mean,
will grow.
It just occurs to me that, I mean, when you dug the pond, you moved soil that was already there to a different spot.
And once you mix it all up and move it all around, and then it's
Then
considered
they call
fill.
it fill.
And they don't want you to put,
Been there 100 years, they still call it fill.
You should know.
I had a house then,
Oh, okay.
and my sister.
and the septic system was in the front, it wasn't back there where you put all the stuff.
So you dug the pump before the house burnt?
Well, yeah.
Gotcha, okay, okay,
Had a nice sandy
Built a
beach,
brand new house.
everything.
okay.
This letter also says that it's severely compacted.
So why wasn't a sand mount an option through the state? Why-
Nobody would make the call.
Because they're saying it's got too much fill material and then the soil beneath the fill material is compacted. They're saying the water won't move through there. Because that's what my proposal is an elevated sand mound. We're just gonna take 5 feet of the dirt out, put 5 feet of the sand so that we ensure we're getting the proper cleaning and cleansing of the pathogens and bacteria before it gets down into the actual soil.
Does the sand mound have a leach field?
That's what the sand is, the leach field basically. So your pipes sit on top and then when the effluent goes into that pipe and it's actually like a serial, it goes into one, back through another, you know, and they're 12-inch pipes, they're huge.
And the length of those, though, is that based on the size of the
Yes.
tunnel?
Well, yeah, so the way that the State Department does it is the number of bedrooms and then the soil loading rate, which is why Jeff's, struggled with it because he doesn't know what soil loading rate to use. So I just use the most restrictive, which is the 0.25, to make it the largest system, the most restrictive.
Which has the longer fingers or the longer?
Yeah, it'll be wider and, so it'll be more area to absorb everything.
You're talking about I'm putting 3 times as much sand in, or 4 times as much as I do on a regular system.
Yeah.
So the sand is your filter.
So could I maybe make a request? And I mean, I don't know, you guys weigh in here, but I feel like we're being asked to make a decision on a verbal description of what the plan is without a written plan that's being formally submitted.
That's what we're asking for. We're just asking for a waiver to let us try this
So we
system.
can.
That's all we're asking
submit the plans and all
for.
that.
But I think that if I could like see a plan that's being submitted to the state, have the state review it and say.
But the state is just advisory. They're just advisory. And they're saying that we don't qualify for anything. They're not going to approve anything. They want us to pump and haul or put a holding tank in or connect a sanitary sewer.
Right.
That's why, and Jeff's been told by the State Department to not allow us to do this.
I'm like,
That's
yeah,
why.
Here's a
But you're trying to present another option and solution. And so I guess what I'm just suggesting is that if you
Well, you're
had
more than welcome to look
that.
at the septic plan, but you're not going to understand any of it. That's what I'm trying.
I did work at the state health
but I
department for a little bit and worked with them a little bit, so I have some knowledge as to the approval process
It's
that
more
the
than just,
state
I mean,
goes
like, there's
through,
right here,
like for
let's see.
homes and businesses and housing divisions, and they don't lightly make recommendations or
9,
refusals, so.
10, there's 10 pages to this plan already, and it's not all the way complete because I've still got some pump information and things like that, but I will be more than happy to email it to you.
Well, I don't think that I'm the appropriate person. I'm just suggesting that if a formal plan was submitted or proposal for what you're requesting to do, and then the opportunity would be for our local person to review that, seek guidance from the state as to what that potential
They're not
is.
going to approve it. They want us to pump and haul, connect to city sewer. It doesn't matter what we turn into it, they're gonna say no. Because
That's the whole point of the letter.
that's why we're coming to you guys to try to
Get
get
this letter, and then
an
once we get
special
this letter, then Brandy can turn that to Jeff, and then we can get Jeff to okay it, then we'll go put it in.
And really what Jeff is okaying is that I've got elevations on there, I've got distances of property line, you know what I mean? That it's not so much the actual system itself, but it verifying that I've got my proper separations from ponds.
So there will
ditches.
be another step beyond our
Yes, we have to,
approval
we
or
have to
our
install a system.
waiver,
Yeah.
right, but there will be another approval step, if you will.
Yeah, you have to make sure we get the system in right.
Correct, yeah, so, right, so that what you're telling us about here verbally today, there will be another check and balance on that to make sure that what you're telling us is what actually
Yes,
happens.
yes,
Take pictures-
absolutely.
We take pictures of every.
Yeah, and Jeff will come out when we get to each step and look at everything.
If I may,
Like closed discussion, or does the entire meeting have to be open? Okay,
Only on personal matters.
gotcha.
Go ahead, Jeff, sorry.
okay, I would still need guidance on the sizing from the board because it wouldn't be legal for me to just size something without the soils and
We're gonna use the
the
most
actual.
restrictive.
Yeah.
You use the most restrictive soil rating. It's a 0.25 load rating. That's the most restrictive.
So Jeff,
I don't understand what you're confused about.
if the board says to submit plans as Brandy has described, and we have, it's being recorded, so we have details of her description,
Okay,
you can verify that the plans are what she has described to the board?
I could take a look at it and do a plan review on it, and I could verify the sizing that way. We just wouldn't have minimum requirements.
Okay, all right.
Does that help?
And then I lost what I was saying. Sorry, I lost what I was saying.
So is that what we would like me to do then, is just submit the plan to Jeff on a 4-bedroom, 0.25 loading rate, and then,
I think, just to make sure, and again, I think we would require this, whether it was you or anybody else.
right.
I mean, I think one of the hard things, and I think we're all conscious of the fact that, this is, you're a board member and this is your property and your home and all of this, and we want to make sure we are avoiding any,
Favoritisms.
or any sense of impropriety in the way that we're handling this, so.
Well, and I think that's to your point. We have to, as a board, make sure that we're providing guidance as we would to any citizen. And, you all have the expert knowledge, but I guess at the end of the day, would any individual in our county have the same level of access to request this from us?
We've already done it.
And
We have that.
would they be advocated for?
Well, let me say.
I mean, I'm just saying, as a board member, that's my responsibility to the county.
Okay, let me say one thing about the man. When that man came in here,
I don't know them and I don't know I was not a part of the board at that time,
nor was
sir.
I.
So I
I was.
have no reference to what you're discussing. So
Okay,
I'm
let
trying
me
to
speak
take
for a second,
today.
okay?
Okay,
So when they came in here, the state was so hard on them. The man said he felt like he was in a war, and he was glad he had a contractor that stood up for him, so he didn't have to spend $75,000. I'm willing to put the best system in you can get, okay? I've been doing this for 39 years, okay? I've been here before these guys was even here, okay? So I wouldn't waste my time or my money, okay? And I did have a house there before, a brand new house I built, and they okayed it, okay? With the old system, I didn't even have to put a new system in, I built a brand new house. Now, how'd I do that?
We don't know.
Well, and the
But, sir,
regulations
I
are a little
think-
different.
I'm just asking for a letter stating that if this don't work, I will cap it and pump it, okay? But I have to have the letter in order to put it in, do I not, David?
Yeah, just in listening to your discussion, trying to answer what I think you're getting at. What I think they're looking for is, because keep the big picture in perspective here. The big picture is that the state of Indiana, the health department is incredibly restrictive on septic systems, especially here in Grant County. Is that a good policy or a bad policy? Well, if you want growth in your county, some people would view it as a bad policy. In other words, we could say sites don't make it, then no one's gonna build homes, and then we eventually die. So the system is put in place for a waiver where you can review each fact. And this is how, I know you're new to the board, you probably haven't seen this before. I've seen it many times over the years, where people come in, landowners, and they state their case, and then you decide whether to give them a waiver. What you're asking for is, as a condition of the waiver, can certain parameters be put in place for the system, i.e. number of fingers, the depth of the sand pit, the area of the leach field, the size of the tank that's gonna come in. A condition that if it does fail, that they will pump and haul themselves. I think that's what you're asking for. Can you have that, not necessarily ahead of time, but as part of the waiver document? And yes, you can. Everything that Brandy has discussed would be put into the waiver itself.
Okay,
And again,
that was not clear before, so.
I appreciate your, evaluation of it. If I'm hearing it correctly, that's exactly the point of the Mannings being here is, there are a couple things, but one of them is that they were represented. They were a family in the community that had this problem, and so they did bring it to us, and we used a contractor to do that, but they were able to do that. So there is, that access has been given, for it. So I hear what you're asking, and I appreciate that, that you were doing that, because that is our responsibility, is to, are we setting something up that's gonna, in the future, cause problems? And it sounds like it's actually the other way around. If we, the waivers, we have to look at the facts as they are presented, and then we make a decision, is what it sounds to me.
All right. Any further discussion? Are you satisfied that we have covered
Yeah, I am. If I
as
could
much of the information as we need to
I would
make
just like
an
to get some
informed decision?
specifics. How many fingers are you thinking?
It's gonna be a sand bed,
No.
so it's gonna be, it'll be 4 rows,
Okay.
72 foot long. The system itself is gonna be 23 foot wide. It'll be 5 foot
Hold on.
deep of,
4 rows times 72 feet, and that's the pipe length?
yeah,
And then what's the area of the
23 foot wide.
23 foot
Mhm,
by 72?
mhm, yeah. So that
And you
gives,
said 4 or 5 feet depth. of the sand.
yeah, so we'll take out 5 feet of fill dirt and put 5 foot of spec 23 sand, which is the type of sand that the State Department requires for septic.
And then what's going to be the size of your tank?
We'll have a 1,250 gallon septic tank, and then there'll be a 1,000 gallon dosing tank that will pump 101.49 gallons each time it pumps.
Okay. And then obviously Jeff can verify that that's happening.
Yeah, and there's also an observation port that gets installed in those systems. and it gets installed on the downslope side of the sand. So you can actually open that and look down in there and see if there's actually
See what's
water.
coming out.
Mhm. Yeah, if there's water ponding down there, we'll know it pretty quickly.
Can I ask a question about, am I allowed to ask a question?
Yeah.
You said about, it's difficult in Grant County to get, that our regulations are difficult to work with. What I understood when this new code was being approved is we could not do anything more difficult than what the state said. The state had a bar set, and we could not make it harder than the state. But we had to align with what the state recommended for our specific septic
Right.
ordinance.
She's talking about the ordinance.
Yes.
Because when I was on the health board, see, I'm the guy that put in the $15,000 bond because people were getting took by these guys that said they knew how to put them in. Well, when you put up a $15,000 bond, at least the people's gonna get $15,000. It ain't gonna cover the whole system. They weren't getting nothing. Well, then the state steps in and says, well, you can't make it strenuous more than we do, but you can. All you have to do is ask for permission.
They wouldn't approve the ordinance, see, and that's the other thing, it's overreach. You know, I mean, the state's supposed to be an advisory. They're not supposed to come in and do it all for your county or take over your county.
Health department. It's always been that way. The state is advisory to come in and say, well, okay, give you some options, you know what I'm saying? But it's still up to the county to make the call.
But not anymore.
So I think you were getting at, we can't be more stringent, but we can be
Yeah,
less
yeah.
restrictive.
Well, I don't,
And that's what
it
the
sounds
waiver
like
process
you
is for.
almost said that we've made it harder than it needs to be.
No,
But
what I was saying is, in the past, that the regulations at times can stop people from building, and there might very well be times when that's warranted. There might be times when it's not, because there's a lot more factors that go into more than just what they look at. That's what I'm saying.
The fact that it's a new home, like if I'm reading this letter, they would consider it by saying it's a new home on the site.
That's why they won't make a best judgment call, because it's new construction.
Right.
Even though there used to be an existing
Right.
home there, they're saying, well, it's been so long ago that
Right.
that doesn't matter anymore, but we pay taxes on this property
Right.
the whole time. So, and we'll pay a lot more taxes on it when we build a house.
Okay.
Is there any more discussion? I'm going to go ahead and call for a vote then.
Somebody has to make a motion of some sort.
Needs to be.
I have to abstain because it is
You
my
do.
personal property, so I
You do.
can't make a motion or nothing, guys.
I'll make a motion if you help me through it, David. I'll make a motion to accept the waiver, have them sign a waiver with all of what you described based on the worst soils and the above-ground sand system, holding the county not liable
in case of failure. Did I include everything, David?
Yeah, I'll include in the waiver, I'll include the specifics for the system itself. I guess you could add that, that the system that's being waived meets the parameters as discussed in the meeting. If that's okay.
It meets Jeff's, he'll still go out and inspect, make sure they've abided to all of those specific, whatever Brandy submits, which is based on, you said, the worst.
Yeah, absolute worst case scenario.
Let me understand just one more time, this waiver then would be filed with the deed?
The waiver is a document that the health department issues and the health department will keep in the file.
Okay,
I suppose it could be recorded, but I don't know
yeah.
if that would.
Would it be
I'm not sure I've ever seen
findable
that
in a
done
title
before.
search or anything like that?
Yeah, that I'm not an expert on title search, so I don't want to answer that question.
Okay, all right,
I know we'll have it in our file as public record.
okay.
That's what I know for sure.
It'll come in the new system that area plan and the health department all use, so it will be attached to the property,
Yeah.
just by virtue of every septic permit that's issued now. is
Okay,
attached to the
okay.
property.
And there will be
Yeah,
notes in
yeah.
the file, I'm sure
Okay.
the notes that you guys got will also be included in the file. I mean, at least I always did, if I got emails,
Sure.
everything goes into the file. And then that all gets scanned in when it's completed, and, Jeff sends me stuff all the time. I'm like, hey, everything on this property, and he'll email me whatever he has. So those are accessible digital records.
What's the likelihood of us having another property with similar situations in the county?
Very high.
I mean, is this a common soil issue that you face? Jeff, I mean, maybe Jeff is I'm just asking, like,
Yeah.
is this a 1 in 1,000? Is this a 1 in 100? Like, do we have any idea? Like,
When
what's
I left the health department 7 years ago, they were saying within like 10 years, these subdivisions that were developed in the 50s and 60s, you're going to start seeing, and the one Manning's property is a subdivision that was developed, and they had the situation. That whole subdivision out there is going to have the same situation that the Manning's had. When their systems fail, they're going to have the same problem. Every one of them are huge, beautiful houses with deep basements, and guess where all that dirt went? All over the outside yard, so that's all considered.
And they're on like a half acre.
Yeah, and they're all like
Once
super
the
small.
system fails, there's not enough room
Yeah.
to put another system in. So
Yeah.
what do? Condemn the homes?
And then they've talked about doing sewer districts, and those are super expensive, take a number of years to engineer, design, and connect people, and I mean, it's gonna happen more and more, and especially, as the time goes on, it's gonna be more and more. I know I had probably 1 out of 10 had fill material, and not necessarily as much as what we have, 5 feet. A lot of times it was a foot or, 16 inches, something that you could get underneath of and still install a system and it not really affect too much. And I don't know what Jeff's ran into lately, but I know it was getting worse, when I left.
That's about what we have. We get like 8 to 12 inches, and then we've got most of them that I've had recently had like greater than 60 to the limiting layer. So we had plenty of soils and everything to get underneath that to install. But she's
And the same-
right. We do have some subdivisions out there that are going to start having some issues that I'm trying to get something in play to work on for when the time comes on that.
Okay.
The motion was made, I shouldn't ask more questions.
Okay, so we need a second.
I'll second.
Okay, all in favor?
Aye.
Aye.
Was that everybody? I'm sorry.
Do we need a show
I'm
of
gonna
hands
abstain
or?
from voting.
Okay. Okay.
It's in 40. Here we go.
Any nay votes? Any nay votes? Okay, all right. You will prepare a waiver. Will we have a chance to see that waiver before it's,
You like,
okay, I think that would be wise.
I would recommend one of you two sign off on it.
Okay, all right.
I think my name's on the permit, and I think my name ends up on the document, right?
Yeah, and on the
Yeah.
permit itself.
And maybe you might as well as president of the board too.
All right.
And I know when I issued best judgment permits, it said right at the bottom of the permit, this is a best judgment call. I mean, we've had to do it. I mean, there's been lots of times that just help, just to be able to help people be able to stay living in their homes. Because the alternative was they're homeless and the septic issue is still an issue.
Sure. All right. Any public comments? Okay. Well, in the absence of that, I believe we can adjourn.
Next meeting, November 25th. November 25th. is
25th,
Thanksgiving.
okay.
Is that the week of Thanksgiving?
Mhm.
Do we need to move it up a week?
I think I'm going to Texas the 1st of November, so, because I was like, I'm not flying that close to Thanksgiving. I just, I don't like to fly during holidays.
You don't like the fly period.
Yeah, I said, I don't like to fly at all, but I really don't like to fly during holidays.
I don't like to drive long distances either.
I don't either. I can only go 2 hours, and I gotta get out of the car and walk to my left butt cheeks now.
Do we want to move it to the 18th starting?
If, either works for me, but
I would say to
18th
be
might be
safe,
better
18th, maybe.
if we have the option.
It's killing her.
Yeah.
We do, I can check it.
Works for me.
You're retired, you can do either. Handing it back to Dr. Brack.
So is it official, we're moving it from the